Hello, everyone, and welcome back to another episode of Exercise is Bullshit, which some of our listeners might not know, of course, stands for BROS, utilizing logical lifting and scientific heuristics to inform training. So we are joined today by Dr., only because it embarrasses her, Sara Oikawa, although she is a real doctor, PhD, from McMaster University up in our neighbors to the north in Canada. So Sara, thank you for joining me today. Please introduce yourself, give us a little bit of your background and maybe your work and school history, and then you can kind of jump into what your current role is.
Yeah, thank you so much for having me, Logan. I'm really excited to chat with you again and to see you again. But yeah, very excited to be on the podcast. Very excited to talk about some things that are very near and dear to my heart, some things I'm very passionate about, which I will not give too many spoilers away, but perhaps the listeners can figure out from my backgrounds. As you mentioned, I completed my doctoral studies at McMaster University in Hamilton, Ontario, Canada. So if anyone's familiar with Hamilton, it's about an hour outside of Toronto. And my kind of research history was in aging, protein metabolism, and then kind of focusing on the effects of protein quality and how that impacts skeletal muscle health, both in response to exercise as well as disuse, because both of those things can happen in your life. And so how we can understand how nutrition modulates your muscle in response to both of those things can be quite helpful. And so kind of background was mostly in aging. Prior to that, I had done some work in young adults, looking at some exercise training in young men. And then I've been lucky enough to have research experience with a wide variety of populations. So I've worked with individuals who are pregnant, cardiovascular rehabilitation patients. I've worked with elite athletes, youth athletes, kind of you name it. And so following my PhD, I was fortunate enough to join the Gatorade Sports Science Institute team down in Bradenton, Florida, to work on some clinical research there at the IMG Academy, which is where our lab was located. And I was on the clinical research team for some time before transitioning into scientific innovation and product innovation from the science side. And so some really cool opportunities and some cool learnings there to work on some really neat and innovative products. And I was there for just under 4 years before coming back up north, back to Toronto to work at Enhanced Medical Nutrition, which is where I am now, and where I lead.
Before we jump into Enhanced Medical Nutrition, sorry to cut you off, you were on a roll there, but I love everything you talked about and mentioning all of that. I think you're underselling your expertise a little bit, though, because for those of our listeners who may know Dr. Stu Phillips, he was Sara's head professor. Was he your thesis advisor? How did that work for you when you were at McMaster?
Yes, and if Stu's listening, I have to apologize for not throwing his name out earlier.
It's okay, that's what I'm here for.
Yeah, so Dr. Stu Phillips, I was very, very lucky to work with him for a very long time. So I volunteered in his lab as an undergrad, and then was lucky enough for him to take me on as a research assistant. I had a year off between my undergrad and my master's. That transitioned into my research master's degree, and then there was very, very, again, very fortunate to have Stu take me on again to complete my PhD at McMaster. So I was with Stu for a very long time and learned a tremendous amount and had a ton of amazing experience from getting to work with, the leader in protein metabolism in the world. So I'm very lucky to have had those opportunities.
Yeah, and Stu is obviously another amazing, really nice guy. For those people who recognize that McMaster is one of the leading sports science institutes in the world as far as protein metabolism goes, and Stu is kind of the guy when it comes to protein science. So when I was originally introduced to you, Sara, Stu said nothing but glowing things about you. So that immediately lit up my spidey senses of, oh, this is somebody I had to talk to. I think you had just made the transition to Gatorade Sports Science Institute at the time, which we can just gloss over that a little bit, but that's a really prestigious institution too, right? Like this is a company that has, been leading the way in kind of sports science technology for a long time. We just think of the sports drink, right? But Gatorade is doing so many innovative things as far as trying to really, really deeply impact athletes in every way imaginable. And then IMG, for those who might not be familiar, is like a world-renowned school. So it's like, I forget what the right word would be, but it's essentially the best athletes in the world get recruited. They go there, they play at IMG, and then they go on to do amazing things. So lots of your, favorite athletes that might be in the NBA or in the NFL have played down in this, which is so funny because for people who haven't been to Bradenton, it's like this little dinky beach town, and I love it. But then you've got this like world renowned, high school and leading into college, they're kind of a prep academy. So didn't want to gloss over that because you speak a little fast, and I want to give you your kudos where they're due. So why don't you tell us a little bit about your current role transitioning into EMN and what that kind of looks like?
Yeah, and that's a great reminder for me to slow down. I'm a fast talker. But yeah, so I am currently now with Enhanced Medical Nutrition. You'll hear Logan and I refer to it as EMN for short throughout the podcast. But I am the Chief Science Officer here, and we are a scale-up company that looks to support patients as they go through elective surgery. Focus primarily here is in orthopedics at the moment. Kind of a beautiful way to tie in my background in aging, my background in sport, my background in movement, and my background in proteins. So my role here is to kind of lead our research and development strategy, as well as support our main product, which at present is a surgical nutrition bundle. So it is a bundle that's delivered to patients' doors that it contains kind of key nutrients and key products that help to support metabolism and skeletal muscle health when you're undergoing this added, very intense stress of surgery. And so typically we're mostly working with orthopedic patients, so total knee and total hip replacements or revisions, that kind of realm is where we're mostly working now. But of course, looking to expand outside of that. But there's so many people that undergo these types of procedures in the US, but across the world. Any given day there's several thousand surgeries, so a lot of people that we can definitely help to recover faster in their surgical journey and to get back to doing what they love faster.
Yeah, I love all that. And I'm super excited to dive into the specifics of, what EMN does and how they deliver that for your patients. I'd like to take a little step back, though, if you can, a brief way, which I know is hard to do because you spend so much time in school focusing on so many different areas. But I'd love for you to talk just a little bit more about qualifying yourself, not that you need any qualification, but just in the sense of your background in research. I'd really like to highlight, when I was introduced to you, I think, gave a presentation about steps and how steps are so important for maintaining health and longevity in especially aging populations, but just overall importance, and how we can use that 10K marker as kind of a way to measure overall decreases in mortality. Can you sort of give me like a 30,000-foot view of some of the biggest takeaways you had? I know this is super hard, sorry, from your time in McMaster, and like some big picture things that you really walked away with from that time, especially working under Stu, of like why some of these things are so important: steps, nutrition, protein for muscle intake.
Yeah, and Logan, I'm really glad that you brought that up because, there are a couple big things. One of them that I touched on earlier, maybe we can start with that. And I threw this word out and then I meant to go back to it. So I'm glad you reminded me. But it's this topic of protein quality that we talk a lot about. And that's something that you would probably hear a lot in a podcast, or you might read in a book, or the average person does not understand what protein quality is or means. And really what we're talking about is the amino acids that make up a whole protein source, knowing the kind of variations in the amino acid content that makes up that protein source. And it's going to be different for every protein. And a higher quality protein would have higher amounts of some of those essential amino acids that your body cannot produce. You need to ingest them through food. Whereas lower quality proteins are typically lower in those key essential amino acids. They're also higher in the non-essential amino acids. When we talk about the effects of protein on muscle or on your health, really what a lot of times what we're referring to when we're talking about high quality proteins is those proteins that can provide the most bang for your buck. So if you're going to have 30 grams of protein in your meal, you would love for it to be high quality protein because then you're getting the most out of that 30 grams. And typically with high quality proteins, we're seeing these sourced from animal sources. From milk, from meat, from eggs, from fish. Those are typically very high quality protein sources. And then lower quality proteins tend to be things like grains and legumes. And of course, there are specific forms of those that can be higher quality. But when we're thinking about a big scale, we're thinking meat sources up here and then plant sources below. Doesn't mean that you can't have a plant-based diet. Of course, there's lots of evidence to show that those are beneficial and you can definitely do it right. It just takes a little bit more effort for you to kind of change the way that you pick foods for your plate that make sure that you're getting all of those essential amino acids that you need. And so kind of to go back to your question, Logan, kind of a quick
clarifying, sorry, there too, because I think, especially as we talk about supplementation as well, because people, I find I've branched into the health coaching space, and people really, when I give them like a protein number for the day, they kind of like, oh my gosh, big eyes stare at me like, how am I possibly going to get there? So supplemental protein, which is something that your company offers, obviously, and we'll talk more in detail about why your blend is so beneficial for your clients. Can you just give us sort of, because I hear supplemental protein, and I know that our listeners are going to think, oh, okay, I just grab a protein off the shelf. Can you talk a little bit about the spectrum of what we should be looking for in like a way to a collagen profile? And it's so funny because I just had this conversation with somebody the other day who was putting collagen in their shake, and without being as eloquent as you, I was basically like, you're kind of better off just throwing that out and getting yourself some whey. So can you give us the more eloquent version of that?
Yeah, so when you're looking for supplemental protein, it's going to come in a few different forms. So one of the most commons that you might hear a lot, and I'll use whey as an example, is whey protein isolate. So an isolate form of any protein is typically the purest form of that protein. So it means that it's been processed and filtered in a way that removes a lot of the other parts of a protein that are not the protein itself. So the crude protein amount is higher in an isolate than it would be for a concentrate or another form of protein. And then whey would be 100% whey protein, which is a specific fraction of milk protein. Again, we said that all kind of animal proteins are usually going to be our best bang for our buck there. But whey protein isolate kind of being our gold standard in regards to having an excellent essential amino acid profile, really delivering the most bang for your buck. If you're having 30 grams of pure whey protein, you're probably, in a scoop of 30 grams, you're probably getting somewhere between, 28 grams of protein in that 30-gram scoop. So it's really to consider the fact that if you go down in decreasing types of protein, so from an isolate to a concentrate, then when we take that 30-gram scoop, maybe we're only getting about 25 grams or 24 grams within that 30 grams. So you just have to eat a little bit more of it to get what you need. And so to your point, Logan, talking about collagen, specifically when we think about muscle health, collagen itself is actually devoid of one of the essential amino acids. We need all the essential amino acids to build one single new protein. So if we lack one of the essential amino acids, we have to be getting it from somewhere else. And that means that we either have to find a food that is high in the essential amino acid, which in this case would be tryptophan, because that's the one that's devoid in collagen, or we would be recycling proteins in our body and taking that tryptophan and using it to build something new. So I think kind of the biggest takeaway here is that proteins aren't created equally. So whether it's the type of protein, like the source of beans, peas, milk, eggs, that's going to make them different and their profile's different. But then also when we think about the way they're processed, there's going to be different levels and purities of protein. And so just making sure that we're being really conscious when we read a label, have a look at the back. If it says the serving size is 50 grams, but then there's only 25 grams of protein on the back label, then you guess 25 grams is coming from something else if the serving size is 50 grams. So half the scoop is 25 grams of something you don't know what it is, but maybe you can figure out from the label.
That was super helpful. Hopefully I didn't derail you there going into your next point, but please continue.
No, it's all good. What's our next point?
You were on a roll talking about your previous research steps, nutrition, protein for muscle.
Yeah. So a lot of this was kind of a lot of the work that we did in the past was to look at the effects of protein quality. And so really to kind of hammer home the point that just for simplicity's sake, getting 30 grams of protein from different sources doesn't always lead to the same result. And so kind of what you were referring to, Logan, was we kind of compared, the gold standard whey protein isolate to something that has, a little bit of a more limited effect on its ability to improve muscle health, which is collagen peptides. So collagens are an animal-based protein. Right now, there isn't a commercial vegan collagen source. And the reason for that is because collagen is sourced from animals. But we were comparing something that we would consider based on a scoring system that's set out by the World Health Organization that ranks proteins from 1 to 0. Collagen is a 0 and whey protein isolate is a 1. And so what we were trying to really hammer home was if you consume a supplement that's a 1 that versus a 0, how does that impact your muscle health? And really our kind of main takeaways, there were two major ones. So one is that when you are undergoing a period of significant disuse, and this is what you were getting at, Logan, with steps, So what we think about a significant period of disuse, this could be recovery from surgery. It could be recovery from an illness. I know we're in cold and flu and RSV season right now. A lot of people I know were ill over the holidays. And so if you had a 2 or maybe less period where you couch potatoed pretty hard, that's actually pretty significantly detrimental to your muscle health and your overall metabolic health. There's some really interesting and very actually frightening research that shows that if you barely move for one day, so say you take, less than 700 steps in one day, which sounds like very few steps, but if you're sick, sometimes all those steps are going to and from the kitchen or to and from the washroom. You can easily
just taking medicine.
Have a day where that happens. And there's some really frightening research that shows that actually puts you into a state of insulin resistance, or what turns into diabetes. So it makes you diabetic for a very short period of time. It recovers, of course, in young, healthy people, but that's a very scary thing. Like, we've all had days like that where we binge watched a show and we didn't get off our couch. So that's a scary thing. So what we were trying to look at was, if you're going to supplement with protein during these periods where you're physically inactive, and they do happen to you, and we already know the physical inactivity is bad, can we rescue this with protein? And what we found was that when you're consuming a higher quality protein, so a 1 at the top of the list versus 0 at the bottom of the list, is once you get back on your feet and you start moving again after those significant periods of disuse, that you're much better off consuming a higher quality protein to start increasing that muscle building process that we see, that happens with muscular contraction or with exercise. So in starting to bring yourself back up to baseline, you're better off consuming something that's a higher quality that can provide you with the essential amino acids you need to kind of rebuild and repair that tissue. The other thing that we looked at was kind of on the opposite end of the spectrum. So on one end, we asked people to really reduce their physical activity levels, but on the other end, we asked people to exercise. And some really cool and interesting work that we did was we had older women consume these same protein sources, so kind of our gold standard and then our lower quality protein, and we had them do a couple bouts of resistance exercise or weight training, and we increased their total protein intake to 1.6 grams per kilograms per day. So this is twice the recommended daily allowance. So everyone got 1.6, but in half the group, the majority or half of that protein was coming from a very poor source. And what we saw was that typically when you exercise, we see this increase in the muscle building process and when you add protein, it kind of potentiates that. And what we saw was when you're consuming that very low quality protein, we actually don't see that rise. And so that's a very scary thing to note, that if you think you're doubling your protein amount and you're doing a good job getting that protein in, but it's from a poor source, we might not actually be doing our muscles the benefit that we could be doing if we just shifted to consuming a higher quality source to supplement and double that protein in our diet.
Yeah, that's really interesting, and obviously kind of a great transition into what you're doing currently with your current role. I'd love to just cue this up too, as we're talking about, your guys' focus right now, and correct me if I'm wrong, is specifically on pre and post surgery, right? And how you're going to help people acclimatize themselves and make sure that they're holding on to as much lean tissue as possible. I know you probably don't have the stats 100% off the top of your head, but you mentioned like one day of 700 steps, and you're basically insulin resistant in that day. Do you remember? Because I remember in the paper you did, or one you shared with us, it was like, can you show us how that magnifies out just a little? You magnify that to 2 days, 3 days, 2 weeks. What does that potentiation look like as far as really getting into a bad place, and why that should maybe scare people to like, oh, okay, if I'm having surgery, this is something I should do about?
Yeah, so it's difficult. To my understanding, there's not a clear picture of how quickly people recover when they enter in this period of insulin resistance that occurs from disuse. But there's some work out of Stu's lab that shows that following a 2-week period of this disuse, that in the 2 weeks of recovery, so participants were asked to reduce their activity levels. They were pre-diabetic. It actually moved them into a state of diabetes, what would be considered diabetes, and then in a 2-week recovery period. And we called the recovery period just return to normal. These individuals were free living in the community, so they just went back to their daily routine, going to the store, doing whatever it is they do. But in that 2-week period where we didn't provide any type of intervention, no exercise program, no diet, they did not move back into that state of pre-diabetes. So because we ended that 2 weeks after, it's difficult to say how long it would take for someone to get back to their typical levels of insulin sensitivity. But at the time, that's what we saw. And keeping in mind that these individuals were pre-diabetic to start, of course, the more kind of underlying health issues you have, the more detrimental all of these things become. Logan, if you were to do 2 weeks of 700 steps a day, it obviously wouldn't be fantastic. You'd probably be insulin resistant. You'd lose some skeletal muscle mass. There'd be all sorts of kind of negative health outcomes. But, you're a young, healthy individual, and you would kind of probably bounce back pretty quickly. And that's been shown from a muscle perspective from some cool work in Scandinavia, where they show that young people bounce back from periods of immobilization really quick. So if you busted your MCL and then we put you in a brace and you lost, 15% quad volume, there's some cool work to show that that's what would happen. There's some cool work to show that, 4 weeks after, if we put you into a resistance training program, you'd gain most of it back. And that's just 4 weeks, right? So that's very short. But there's comparative evidence in that same study to show that if you're, over the age of 60 and we put you through intense resistance training, that you don't go back to 100% after 4 weeks, whereas you as a young person would. And so age, comorbidities, all sorts of things, these things unfortunately all add up to make it harder for you to succeed from these kind of detrimental health periods.
Yeah, that's super scary and daunting. And I think exactly, the perfect kind of way to queue up what we want to talk about with EMN and all those things. But I think it's interesting too, because it seems like 700 steps is such a small amount, right? Like, oh yeah, of course I'm getting more than that. But again, from my own experience in health coaching, it's really interesting to see how sedentary people are. And one of the easiest things that they can do, and we harp on this so frequently, is just get up and move around. Because again, even if you're healthy and you're working out and you're doing other things, but you're doing workouts in short spurts, right? You're only working out for 30 minutes, 60 minutes, a few times a week. It's still not going to it's going to be beneficial, right? You're going to be better off than somebody who's not doing anything, but it's not going to be the same benefit as somebody who's maybe not working out as frequently, but they're moving all the time, right? So, when you think about this compounding over 5 years, 10 years, and you've been at your desk for 2 decades, it's like, okay, now we're in a really bad situation. That I think is a perfect way to frame up kind of what we're talking about next. So tell me a little bit more about your current role. I know you mentioned you're leading the science team now, but dive a little bit deeper into the specifics of the program. Why was it developed? And then we can kind of dial into the nutrients and why this blend is so powerful.
Yeah, absolutely. So before I get into that really quickly, I can send you a paper and you can post it along with the podcast. But something interesting that we could talk about at another time, Logan, is something called exercise snacking. And this has been made published and by a lot of researchers, but recently looking at insulin resistance from another researcher at McMaster, Marty Gabala.
Are you familiar with Michelle Seeger as well? Dr. Michelle Seeger? Yeah, she talks a lot about that as well. But I love Martin Gabala. He's a great guy as well. So that's awesome. But please continue with exercise snacking. That's great.
Yeah. So, so kind of the easiest way for me to explain what we're doing at EMN and with our surgical nutrition bundle is what we call it. It's called EnRoute. But really the easiest way to put it into perspective is if, Logan, you were going to train for a marathon, you would have to. It's a very stressful experience that would happen to your body, right? You're going to run 42.2 kilometers, and forgive me, I can't remember what that is in miles, but it's
26.2
miles, right? And that's extremely strenuous. It takes you anywhere, depending on if you're really fast, somewhere, north of sub 3 hours to, even if you're a slow runner, maybe it takes you 5 hours, but that's a very long time to be running. And so what you would do is if you were training for this marathon, because you're going to undergo this pretty significant stressful period, is you would change your diet, you would change your sleep, you would do all these things to help prepare your body to withstand both the training, but also the stress that you're going to experience in running the marathon. And so we view surgery as kind of a very similar experience. If you do exactly what you're doing now, and you go into this extremely stressful experience, which is, maybe a knee or a hip replacement, you're not necessarily going to be physically prepared without doing anything else, without changing your diet to withstand those demands. And so that means going into surgery, you want to be at your best you possibly can be. If you're going into your marathon, you want to have trained, you want to have had the right nutrition. If you're going into surgery, we want you to at least have had the right nutrition or adequate nutrition going into surgery. So this means that making sure you're getting adequate protein, make sure you're getting adequate micronutrient intake so that you're as healthy as you possibly can be going into that surgical period. So that's kind of the pre part. The post is that you've now undergone this significant stressful event where your body is now repairing from, we'll go with a knee replacement, right? From a massive incision, from different layers of tissue having been cut into, from your bone having been fragmented. And then now, not only are you recovering from the physical stress of surgery, you have to be relatively inactive. You can't go back to the gym right away and start lifting weights. Sure, you're standing up and walking around, and that's fantastic. But at the same time, we know, because you set this up so nicely, you'll be less active than you were before surgery, which perpetuates this loss of skeletal muscle. And so what happens is you're both losing muscle mass because you're not doing as much, but also following surgery, you enter into a period of a catabolic state. So a net negative energy balance, net negative protein balance, and this results in an accelerated loss of muscle, as well as an increase kind of inflammatory profile, increase in cortisol, increase in all sorts of things that kind of negatively spiral. So you're getting hit from all sides. And so if you're not consuming adequate nutrients to support your recovery in this time, maybe you're not as hungry, maybe you just aren't changing your diet, you're not getting enough nutrients to put yourself into positive energy balance, one. And two, if you're not getting enough protein, all of our tissues are made of protein. And so you need to have those building blocks, ingest them, so that when you're rebuilding all these parts of your body after your knee replacement, you have those building blocks available to you to rebuild that tissue. So if you're not consuming enough protein going into surgery, you're not consuming enough protein coming out of surgery, how are you going to have enough nutrition available to kind of build yourself back up? And kind of why we're so passionate about this is because when you're going into surgery, maybe your physician has mentioned nutrition to you, your surgeon, maybe they haven't, right? There's so many things they need to talk to you about. There's so many things they have to prep you for, and nutrition often falls off that radar. So what we're really trying to do is provide both that nutrition as well as the educational support to patients so that they have an opportunity to do everything that they can to have better outcomes following kind of these major surgical and stress events.
Is there a reason in your experience that you noticed why surgeons specifically, because this is something, again, anecdotally I've seen with clients in the past where, they're preparing for some kind of major event, a hip replacement. I've had quite a few hip replacements from my clients over the years, or a knee surgery or whatever it might be. It seems like unless they're hearing it from us as their personal trainers and health coaches, they're not hearing it at all. Is there a reason in your experience why there's such a void in surgery? Is it because they've got so many other things going on, or because they're so busy? And is there potentially at some point a shift that's going to happen? Because obviously it would make major advancements in the way that people are recovering and actually not needing future surgeries, hopefully, or not dying, post surgery.
Yeah, it's a great question. And I think it's probably quite multifaceted, right? So I think a major thing is that it's not part of the standard of care. So typically, every time you go in for a surgery, it doesn't matter even what kind of surgery you have, but they'll tell you, fast before midnight or only have this to eat or whatever. And that's what we would call a standard of care. But that's built into every practice, whereas nutrition is not built into the standard of care at present for surgery. So that's one thing. The second thing is that the surgeon has very limited time with you. They can prep you for surgery, but they're probably focusing on specifics and logistics around your surgery, less time for them to get into the specifics of nutrition. And then the other piece is that, of course, there are always going to be different cases, but surgeons aren't necessarily experts in nutrition, right? They're experts in a knee or a hip replacement. They're experts in exactly what they need to be an expert in. And though they are educated on nutrition, they maybe don't feel equipped to be able to guide you in that way. Maybe they don't have a dietitian on staff. There are all sorts of reasons why patients aren't receiving that type of counseling before they go into surgery. But that shift is coming, as you said, right? Everyone is a lot more focused on their health. The patients themselves, they're asking those questions. They are looking things up online. And it's becoming very clear over and over and over again that individuals who go into surgery in a state of malnourishment, and by malnourishment, we both mean being underweight, not consuming enough calories, but also not getting enough of being deficient in nutrients that you need. So an individual can also be overweight and still be considered to be malnourished. But there's evidence that's been shown kind of over and over again that if you're malnourished going into surgery, you have significantly greater increased risk for complications. So for a revision, for a surgical site infection, for readmission. it's not a secret that the healthier that you are going into surgery, the better you will be coming out of surgery.
Yeah, and speaking of that, and before we get obviously into how EMN can help, and I know we touched on it a little bit, I think it just would be helpful to frame this up even a little more specifically in the sense that, I was looking up studies before we sat down, and there was one I found which I thought I linked, but I obviously didn't link. But I pulled out some of the data from it was individuals over 65 who were going in for hip surgery had a threefold increase in death within the next few years. I think it was within 2 or 3 years post-surgery. We think of, oh, okay, I'm going to be like, yeah, I'll be out of shape, but I'm already out of shape. And that might be true if you're 25, if you're 35, if you're 45, right? But once you pass that certain threshold of aging, it becomes an issue of life and death. And that's not an understatement to say that if you go in and you're not prepared for what's coming, and especially if you're very ill prepared, that simple surgery, that in and out same day procedure can all of a sudden become something that's really going to increase your chances of overall morbidity. Are there any other statistics or specifics of that stuff that you've maybe gathered as you've been sort of in this field a little bit more that can kind of paint this picture and the serious nature of it? And then we can talk about how using something like EMN can maybe help people prepare for undergoing surgery.
Yeah, we kind of touched on it earlier, Logan, where we talked about the recovery from immobilization with older people. So even with intense resistance training following an immobilization period, those over the age of 60 didn't gain back as much muscle mass as those who were under the age of 30. And this is because of something called anabolic resistance. So as you age, you become resistant to the anabolic effects. So anabolism is growing. So the anabolic effects of both exercise as well as protein ingestion. So both consuming protein and doing exercise stimulates the muscle building process. And as you get older, it takes more exercise as well as more protein to maximally stimulate that response to get your muscle building process going. And so what happens is when we get older and, we're 65 and we have a hip replacement, that's a very strenuous situation, high metabolic stress that occurs on your body, high physiological stress, then also a remarkable period of disuse and inactivity. And so you lose that muscle mass. We know that's going to happen. It's inevitable because you are, in a period of disuse, and we'll never pretend that something that you can eat right now that we understand is ever going to save you from that. You cannot out-nutrition physical inactivity. It's just unfortunately not the case. You can do things to help yourself. But then what happens is you're 65 and you've had this surgery, that period of disuse where you've lost that muscle, you've become insulin resistant, all sorts of things that are not great for you, don't necessarily recover, or they don't recover fully. And then it becomes this really horrible cyclical cycle where you lost strength, you lost muscle, you're insulin resistant. Now, 6 months later, you still haven't fully recovered. And then that puts you at greater risk for falls, which puts you at greater risk for fracture, which puts you at greater risk for being back in the hospital again, which puts you back into a period of prolonged disuse. So it's this really, really terrible cycle of inactivity that occurs from that one event that you had. And so to your point, Logan, trying to stave off that first event for as long as possible is really key there. But unfortunately, of course, if you're undergoing a hip or a knee or a total joint replacement, the point of that is to help you be more mobile, to be more active, to get moving faster again so that you're in less pain. And so you can't always prolong that.
Yeah, so obviously we know there's a lot of things that people can do if they're being proactive to make sure that they're as prepared as possible. And I like to think, and correct me if I'm wrong, EMN is a great option for people who are looking for the lowest hanging fruit that can potentially help them. So can you talk to me a little bit more about what makes your guys' specific blend different than just going to like a GNC, right, and getting some whey protein? We talked about whey protein isolate. I'm just going to get some whey protein isolate. Like, what is specific to your blend that's going to be helpful for people? And then what are potentially some of the ways that people can learn more? How can they inquire about this? What's a good time frame? Like, sort of talk to me through, I found you guys online. It's 3 months pre-op. What can I do to prepare myself going in? Give me that whole shebang.
Yeah. So maybe just to, right out the bat, you could totally go to a GNC and, do this yourself. And that's great. You could try and do it through your diet. Obviously, a food first approach is
Bad
always
sales pitch.
is what's always recommended. But the reality is that most people won't do it, and they also probably don't know how to do it, right? Nutrition is complicated. There's a lot of information out there around what you should and what you shouldn't eat and how much you should have, and it becomes very complicated. I think at the end of the day, what we see is around over 75% of patients going in for total joints, so total hip and total knee, are not consuming adequate protein, both to meet the demands of surgery as well as for their age, because they're similar. It's around 1.5 to 2.0 grams per kilogram per day is what's recommended for age, as well as what's recommended to help you recover from surgery. And we're seeing, about 25% of patients meeting that and 75% not. And so what that tells us is that really most people can benefit from adding more protein to their diet. In regards to what, we're offering to our patients, our product is a patented blend, so it was actually studied out of Stu's lab at McMaster by Dr. Kirsten Bell. So she studied a protein multinutrient supplement and found that consuming this supplement for 6 weeks in the absence of exercise actually increased muscle mass and strength in older men without having to exercise. And so there's some key ingredients in there that help to improve your muscle health. And so we're leveraging that same science in our product. It is a bundle, so patients take it twice per day, 2 weeks before surgery and 2 weeks after surgery. That's both to help elevate total protein intake as well as receive the benefits of this protein multinutrient blend. Another piece that we haven't really talked about that's included within the product is our complex carbohydrate beverage. So it's a maltodextrin beverage that patients take the night before surgery, but depending on their anesthesia protocol, we recommend that they take it about an hour before surgery. And a lot of anesthesia protocols, we kind of talked about this a little, don't let you have anything before surgery. So of course, we always want you to follow your surgeon recommendations. But if they allow it, it's really beneficial for you to try and consume some carbohydrates, clear fluids, carbohydrates before surgery. And the reason being that if you think about surgery, it's the kind of a same physiological response that happens when you undergo stress. So think fight or flight, right? So for anyone listening, if you're not aware of what happens in a fight or flight response, you obviously get that rush of adrenaline, that epinephrine release. But what that causes, along as with a lot of other kind of hormonal responses, is that we release a ton of glucose from our muscles because we want to have quick energy, because we have to fight or flight and run away. But in surgery, that same trauma happens, but you're not fighting there's no fight or flight. So you've released all this glucose into your bloodstream, but you're sedated and of course having surgery. So now you have all this free glucose in your bloodstream and you're not taking it back up, because part of the response is we reduce the amount of insulin that's available, because in a fight or flight, you don't want to hide that glucose. You want to have it available for you. But in surgery, it's actually quite detrimental, because now you have all this circulating blood glucose, which is not very good for you and puts you into the state of diabetes. But if you consume carbohydrates going into surgery in close proximity, what you've done is before that stress, you now have elevated insulin release, which means that when you go into this period of stress and they cut into your leg or your hip or whatever, now you're able to take up some of that excess blood glucose and helps to reduce the risk of insulin resistance that we typically see post-surgery in patients. So it's kind of, we're trying to support you going into surgery, make sure you have the right nutrition, trying to support you really up until the moment of surgery to make sure that we reduce the risk of some of that increased catabolism as a result of that fight or flight response. And then also post-surgery, making sure that you're adequately prepared. You have all of the, not all of, but more nutritional support to help with that recovery process. Make sure that you're not deficient in protein and other nutrients so that you can heal faster, quickly, heal completely, and get back to doing what you want to do all the time. Getting back on the golf course, playing with your grandkids, walking around the block with your friends, that type of thing. So really kind of a comprehensive package. It's only 4 weeks. Of course, you could benefit from taking it longer. You could benefit from taking it longer before and longer afterwards. Right now, it's difficult to get people to do it for that 4-week process, but we do offer an extension of the products so that individuals can continue to take it after, or if they want to purchase it in advance, they can start taking it before.
That's awesome. And obviously, we'll share how people can learn more before we jump off here. Talk to me a little bit more, because listening to you explain sort of the insulin uptake with the glucose, it's something I never thought about with surgery, right? And any kind of fight or flight response from that. Is there a reason why that wouldn't be recommended by your doctor? Because you said obviously you talked to your surgeon beforehand. Is there pre-existing conditions, maybe somebody who's diabetic or something going in that wouldn't want that, or how does that typically work from a pushback perspective?
Yeah, so there's a couple of things. So it's actually threefold, but we'll start with the easiest ones. We kind of talked about this earlier, but a lot of protocols for surgery are, an 8-hour fast, so nothing past midnight. You can't have any food or drink, and the reason for that is the anesthesiologist is worried about your risk for aspiration or for vomiting on the table and then breathing it back into your lungs, which obviously is not good. And so if your stomach is empty, then that way you're not going to have anything to vomit and then nothing to aspirate. But there's tons of data that shows that consuming clear fluids, depending on the density, carbohydrate density of the fluid, will empty from the stomach relatively quickly. So this is usually carbohydrates that are absorbed quickly versus if you think like a protein or fat, which is absorbed slowly in the stomach. So if it's a clear fluid, your risk for vomiting and aspiration is a lot less because it's able to be absorbed faster. So even within that 1-hour period, it really should empty from the stomach within that 60 to 90-minute marks. A lot of anesthesia protocols are still stuck on the 8-hour fast because if you for some reason didn't follow the rules correctly and then you get to your surgery date and they're like, did you have anything to eat? And you're like, oh, I had a bar of chocolate, and they have to cancel your surgery. So it's easier just to tell you not to have anything. So it really depends on the surgery center, but this is becoming best practice. It's something that's consistent across what's called the enhanced recovery after surgery guidelines. So these are it's a multifaceted approach to help improve surgical outcomes across multiple surgical specialties, but a main component across them all for the most part is this carbohydrate load before surgery. So that's why there's this pushback, but we're hopefully moving more towards it. In places like Europe, we're seeing this happening all the time in every hospital center, whereas in North America, we're a little bit slower to the uptake there. In regards to your point about diabetics, so of course, if you have type 1 and if you have uncontrolled type 2 diabetes, we don't recommend you do the pre-carbohydrate load, obviously because you're already having issues with glucose regulation. But there is some really cool evidence that actually just came out that showed that individuals with well-controlled type 2 diabetes can actually still benefit from doing the carbohydrate load before surgery. So evidence is still emerging, and obviously patients face a multitude of complications depending on what state they're in going into surgery, but it's slowly being adopted.
That's cool. And when we talk about a carbohydrate load from that maltodextrin drink, how many carbs are you talking about? There's 30, 60, 100 grams. What are you looking at?
So before surgery, it's a 50-gram dose. The percentage that's been studied is to mix it to be about a 12.5% concentration, but the standard dose is around 50 grams.
That's super interesting. So obviously now we kind of know what EMN does, just stepping outside of the box of your specific recommendations, because I think all of our listeners will have been impacted by surgery in some way, right? Whether it's your family member, your mom, your dad, your grandparent who's had hip surgery or fallen, or you're expecting, I have plenty of friends. I'm in my 30s now where somebody's playing pickleball and they blow out their Achilles or something, right? So it's like, this is something that affects all of us, right? So what other things can we be doing? I think we both know the answer to this, but talk to me about some other recommendations if somebody is maybe just trying to prepare themselves in case this time comes. Like they're 60 now, they know that their likelihood of getting surgery or some kind of surgical intervention in the future is building up. What would be some general recommendations, protein guidelines? I know you've talked about them, but maybe just really dialing that home. And then what, exercise, things like that. Give us some general recommendations.
Yeah. It depends on how far out the timeline is. But, I think that everyone, regardless of what age you are, as long as you're over the age of 18, I suppose, we'll give that recommendation. But everyone should be looking to increase their physical activity levels, right? It's a move it or lose it situation. And then once you hit kind of that 50, 60 year age threshold, it becomes more difficult for you to gain muscle mass. It doesn't mean it's impossible. Of course, that's not true, but it becomes more difficult. You need more exercise, greater volume, and you need more protein, as we discussed before. So even if you don't even see surgery in your future, you should always be looking to be the healthiest you can be, consuming a balanced diet, as well as exercising regularly. And that includes resistance exercise. So obviously huge huge implications for endurance exercise, for cardiovascular health. But resistance exercise at the end of the day, or strength training, is what's going to help you maintain that quality of life. So if we think about aging and losing some of that muscle mass and losing some of that strength, if you're not able to get off of the toilet or off of the couch, or if you're not able to stop yourself from tripping when you step off a curb, those are things that seriously impact your quality of life. So maintaining strength, maintaining muscle mass as we age becomes significant. So even if you don't see surgery in your future, you want to make sure that you're always as prepared and as healthy as you can be. And hopefully, as we talked about before, this just pushes that surgery off into the future. Depending on how close you are to your surgery, if you know you're 3 months away. In Canada, sometimes you can be 18 months away before you know when you're going to have your surgery. There's a really cool topic. So I talked about enhanced recovery after surgery, which kind of focuses on surgery itself and then after surgery. But then there's this whole other area of science called prehabilitation, which looks at, getting yourself ready for surgery. And there's tons of literature to show that it is effective. And it's specifically if you can do something what's called trimodal prehabilitation, where it's both nutrition. So make sure you're augmenting your protein intake, making sure that you're getting yourself nutritionally ready for surgery. You're exercising, so getting your physical fitness up. And then psychological. So people that are more psychologically prepared to understand what they're going to go through and what that rehab process is going to be like after, all of these three things impact recovery post-surgery. So immediately after surgery, these people are doing better. Those who have engaged in prehabilitation are doing better than those who have not, because you've kind of done all of the homework to make sure you studied for that test. So when surgery happens, you know what's going to happen to you. You're physically ready to withstand it and you're mentally ready to withstand it. So that's a little bit closer in if you know surgery is happening. If you don't know surgery is happening, diet and exercise and sleep and fluid intake and all the things that, get hammered down to us all the time. But it's really just living a healthy, active lifestyle, eating well, exercising as much as you can, that are really going to help you in the future.
Yeah, I love that. And I think back to your marathon kind of reference earlier as far as like the difference of, preparing for 6 months going into a marathon versus, oh, I'm just signing up on a whim. And how that's probably going to turn out for you depending on the situation from like a steps perspective, because obviously steps are something that gets, talked about a lot. Would you have a general step recommendation for people? And then just for older individuals, especially, I know you talked about looking for higher quality and potentially higher amounts of protein. Can you just re-emphasize that for us as well?
Yeah, so I don't have a step amount. And this is because that 10,000 step a day mark was kind of an arbitrary value that was chosen and people ran with it. It also has a lot to do with intensity, right? So if you saunter around the block for 10,000 steps, that's still better than doing absolutely nothing. But, there is a level of intensity that's required in order to reap the benefits of improving your health. And so if you're going from 0 to 10,000, of course, that's going to be a benefit. But if you're already getting, 7,000 steps per day and you just add a few more, is that going to really move the needle? Probably not. We're looking for intensity, we're looking for weight training, we're looking for power, especially as we get into kind of past the 50, 60 age mark. Like power is a really big deal, right? It's generating that force quickly to be able to catch something quickly or catch yourself or pick something up off the floor. Those things become important. In regards to protein intake, so generally, when we think about people over the age of 60, really starting probably, if you can, in your 30s, 40s, 50s, we're looking to increase total protein intake. So the recommended daily allowance, and this will all be in kilos, I apologize, but maybe Logan can do some quick math in the comments here. But for over the age of 18, it's recommended individuals get a recommended daily allowance of 0.8 grams per kilogram per day, which is quite low. And we know for aging that we want this to be closer to over 1.2 grams per kilogram per day and maybe even closer to 2 grams per kilogram per day. And that's a lot of protein, right? Because just for the sake of math, if you are 100 kilos and you need to get 2 grams per kilogram of protein per day, that's 200 grams of protein, and that's a lot. And that's kind of where supplemental protein comes in. Because if you think about trying to get 200 grams of protein from your daily meal, like that's a lot of meat. And if you're a vegetarian or a vegan, like it becomes even more complicated. And then, if you are a vegetarian or a vegan, we go back to that issue of quality. You can still get 200 grams a day, but is it the best quality that you could be getting? Maybe not. And so supplements really play a nice role here because they allow you to get that extra protein in with less effort. So you can still have your balanced, plates at every meal, but then maybe between meals, you supplement with, a 30-gram protein shake. You do that twice, 3 times per day, and you're able to meet your protein goals without having to eat another plate of food.
Yeah, I think those are great recommendations. And for anybody wondering on the conversion, it's pretty close to what I recommend to most of my clients anyways, which is typically zero point 0.7 to 1.2 grams per pound. So roughly, the numbers I've heard in kilos before is like 1.6 to 2.2. So essentially the same. The typical recommendation I give for somebody is just 1 gram per pound of ideal, right? So like a kilo per kilo kind of thing, of your ideal body weight. And more than likely, people are going to be a little larger than they would like, right? So if you're 200 or 100 kilograms, you probably want to be 80 kilograms, right? So knowing that you can shoot for that much more attainable goal, you're still going to be well above the recommended dosage. And that's just a pretty good starting kind of range for most people to shoot for. But yeah, I couldn't agree more. And then obviously, like you said, as you get older, appetite goes down a little bit, or you're eating not the best foods most of the time. So finding supplemental protein sources that are, again, higher quality is going to be of the utmost importance. Just lastly here before I let you go, Sarah, because I'm sensitive to your time, is, if somebody is interested in this, or they know they've got a parent, a grandparent that's going to be undergoing surgery, how can they learn more about enhanced medical nutrition? What's the best way to reach out? Or is this something they're talking to their surgeon about? Are you guys available all over the States? Give us kind of your sales pitch on all that.
Yeah, so we're available all throughout the States, as well as we've recently started to sell in Canada as a Canadian company. Of course, we need to service our Canadian patients, but we're selling primarily in the US. We're available across all of the US. It is a medical food, so it needs to be recommended by your surgeon. So I would recommend that you have a conversation with your surgeon around nutrition, what they think might be a benefit to you. You're welcome to bring our name up in conversation. Our product is called EnRoute. It's spelled very French Canadian, EnRoute. But where you're en route to a faster recovery. But of course, always recommend anything medical that you're speaking to your surgeon, to your healthcare professional. If you want to learn more about our products, we have tons of information online. Our website is getenroute.com. And then our enhanced medical nutrition website is emn.health. But I think a key part of what we try and offer to our patients, depending on if your surgeon has recommended us or not, is we do have dietetics supports. We have nutrition experts that are there to help patients if they have questions. It could be questions about using the product, but it could be questions about their general diet or questions about nutrition, and it allows the patient to be able to rely on an expert source and not have to rely on the limited time they have with their physician. So we're really trying to be that extra helping hand to patients. It's an extremely stressful time for you when you're going through surgery. There are so many things you need to consider. And if nutrition can be one less thing that you have to worry about, we'd love to be able to provide and help you with that. So that's kind of our main goal there, is to really just be an ally to the patient, an ally to the surgeon, and ensure that everyone's doing the most they can so that we see faster and better recovery in people so they can get back to doing what they love.
That's awesome. And is that something that's available only to clients that are using your services, or is that okay? So they get prescribed and then they have access to the EMM dietitians and nutritionists?
Yeah, so it's a service
Yeah.
that's available to patients that where their surgeons are currently working with EnRoute. So if you happen to chat with your surgeon and know they're interested in learning more, we're always happy to speak with them about it. But if you're just interested in learning more, patients can always access our website as well as I mentioned, getenroute.com, and we have plenty of information there as well. That if you're just curious about the product or curious about doing what you need to do in preparation for your surgery. Hopefully there's some helpful resources there for you as well.
That's awesome. And that was super helpful. And last question, and this is kind of joking, but kind of not. If somebody's interested in taking your product, right? You've seen that, you've talked about how it's been patented and it's clinically proven to, I can just sit on my couch and turn into Arnold Schwarzenegger. I'm paraphrasing. But if I wanted to do that, or if I wanted a better protein blend, is that something that you sell to the general population as well? Could just average Joe Schmo just buy some EnRoute, or does it have to be subsidized by their insurance?
So it's not covered by insurance. Currently, no medical foods are covered by insurance per the
Got it.
FDA, but that might change in the future. It is covered by FSA and HSA plans if you have one. But in regards to selling to the general public, so kind of the definition of a medical food is that it has to be used with the supervision of a physician. And so it's right now not available to the general public, but that might not always be the case. Can certainly look to find something, either comparable or something else that could help to improve your nutrition in that way. We do have a separate product called Ice Solution, which is our plain whey protein isolate, which is available to the general public.
There you go.
It doesn't have all the bells and whistles of the patent, but it is an extremely high quality whey protein product that you can purchase as well, which is a great way for you to just increase your protein intake. It's a very clean tasting way, easy to up your protein intake that way.
Awesome. And if you're really nice and you reach out to Sara, she might share the patent information with you and you can just make your own at home. Probably not, but she might. No, Sara, thank you so much for joining us today. I really appreciate your insight and your expertise. And it's really been helpful for me too, to just have another resource that I can talk to clients about, because it's going to continue to be something, especially with the population that I tend to work with. They tend to be a little bit older. I've got a client who's looking for her second hip surgery, and it's just, things wear down over time. But, to have a resource like this where she could really be prepared going in, it just makes me feel confident in knowing somebody like you is over there doing the good work to have a quality product that I can recommend. And honestly, I'm just really excited to see you guys expand and see what's coming in the future. So did you want to share like your Twitter, Insta, any of that stuff?
Yeah, so my Twitter is just Sara Oikawa, at Sara Oikawa, so SaraOikawa. Yeah, you can follow me on there. But I just want to thank you, Logan, for having me. It's always a pleasure to speak with you, and the work that you and your team are doing and helping to keep people moving. But that's one of the biggest keys we talked about before. You can't out nutrition, a poor lifestyle, lack of exercise. Exercise really is the king here, right? So you're all doing the good working, trying to get people moving more frequently in their homes, however they can, and that's step one, right? It's a lot of hurdles, changing your nutrition, adding in exercise. It's a lot of work to do, and they go hand in hand. And so really, we're a small step, but obviously love the work you're doing, love the motivation that you're providing to people to keep them moving and keep them healthy. And both of those things really help improve the lives of everyone. But yeah, I think they go hand in hand.
Well, I appreciate that. And I'm hoping that we can find a way to collaborate in the future, because again, I think what you guys are doing is really powerful, and to be able to pair that, which is obviously outside the scope of what you're doing as a medical nutrition company, but to have resources, to have things that clients could be available to use that they can do from anywhere, I think is just super powerful and empowering for people who are facing this potentially daunting thing. To have resources, and as many resources as possible, to make sure that they're going to be, as well prepared as they can be. Awesome. Thank you again for joining me, Sara. Thank you guys, everyone, for listening. We look forward to more episodes in the future, hopefully getting Sara on again. Maybe we can talk about that study you mentioned another time. And big shout out to Stu. You did good. You're doing good work out there, Stu. Keep cranking out the good students. We'll see you all again soon. Please like and subscribe.